ago, Parliament's Health Committee went on a fact-finding tour of the Kenyatta National Hospital. It revealed quite some issues there. Talk of understaffing, ill-equipped to handle what are some of the needs of this modern day. And those who went on that tour were appalled by the sorry state at the region's largest referral hospital, occasioned by congestion at the wards. Joining me in studio to talk a bit about this, let me start from the far right there, Dr. James Nyikal, who's a member of Parliament, Seme constituency. Welcome to the program. And right next to him is Samuel Oroko, who's the chairman of KMPDU, Kenya Medical Practitioners, Pharmacists and Dentists Union. Gentlemen, welcome to the program. Thank you for finding time. Let me start with you, Dr. Nyikal, because you had time to visit Kenyatta National Hospital. We actually watched you live on TV during that fact-finding tour. To kindly share with us what revelations came out of that tour.
Well, as you indicated, the issues that really came out is that one of overcrowding in the hospital. There are a lot more patients than the hospital can accommodate. So you have people sharing beds. If you go to the newborn unit, you find that babies are sharing incubators. Incubators are meant one per baby. But there's that massive congestion there. You go to the emergency department, you find patients lined up as if they're in a ward, nothing happening to them, but this is an emergency area. And the people that they have there, they have about 6 consulting rooms, and I think some 4 referral rooms. They are basically inadequate to take care of those numbers. Now you look at the equipments are not adequate, particularly the high-end equipment. If you look at like Kenyatta has the capacity.
Some of them were described as old, inadequate, outdated in terms of equipment.
Those sound like my words.
Yes.
Yes, they were actually obsolete, although still working. And the word obsolete doesn't mean that the machine doesn't work, but you get into a problem when now you want to service it and replace the parts, because then you will not get the part. So you still struggle with it. And definitely they are old, and they are not enough. You look at, for example, they were talking of laparoscopic surgery. A lot of surgery is now going to minimal surgery, where through a small hole either in the abdomen they can see in and do surgery, and they need about 4 of them. They have none really of their own. The one they have, which is working, I think is probably borrowed, but that one is working. There's one, but they need about 4. So there is another one that is probably on the way coming. You look at if you're going to do high-end operation on the heart, the open heart surgery, they have only one heart lung machine. Again, that one I think they got from Mata, and the one that they have is not working. And actually they need 2 if they are at work, because when one is not working, the hospital cannot afford to wait for you to go and repair. Yeah. So
it feels like you have a very long list.
Yes.
of some of the issues.
So let's just say that basically they are not adequate. There is congestion. Even staff, they don't have adequate staff. The nurses, they say they have a shortage of about over 1,000 more nurses that they need above what they have now. And the doctors, the same. But then they also have another problem, that Kenyatta has 2 main functions. It's a referral and a teaching hospital. And I don't think we have looked at the problems that arise from being a referral hospital and being a teaching hospital. For example, the doctors who work there, the registrars who do the majority of the job, about 90% of them are actually not employees of Kenyatta. They are people who are under training. So, but they are the people who man the place. The consultants, about 50%, 50 to 60, will be employees of the university, who really, they don't really answer to Kenyatta management. So in that kind of situation, you find that you actually have a policy and a structure failure. Because if you have functions that are assigned to you, but what you are doing are not those functions. That is, or the functions are not adequately funded to realize what they should do. Now, referral, it means they should only be dealing with cases that have come from elsewhere. But right now, it's accepting everybody.
You hear somebody saying, I'm off to Kenyatta.
Yeah, off to
even without
Kenyatta.
getting a referral.
And
Okay.
then the other counties that are around, they have bought ambulances to bring patients to Kenyatta.
That is very, let me bring Chair Oroko into this. Are you surprised by these revelations?
I'm not surprised at all. One, because Kenyatta is simply a smaller problem of a bigger problem we have as a country in the management of our health system. Because apart from Kenyatta, we have other facilities which are public and still are offering dismal services. Because as Mheshimiwa said, Kenyatta was designed to handle issues of referral cases. But right now, everyone, including those who have a flu, come to Kenyatta. Why? Because when they go to Mama Lucy, Mbagathi, they keep being referred to Kenyatta National Hospital because these other hospitals are not functional.
So it's not them who ask to go. It's the doctor just says, this matter is beyond us.
It is the system failure.
Okay.
And for example, in Kenyatta, this congestion, if you go to the orthopedic ward, you find many patients, others sharing the bed, others are lying below the bed, others are using mattresses on the corridors. Why? They require to go to theater. But before you go to theater, if you have a fracture, you need what we call an implant, a metallic thing which is used to fix your bone so that they can heal for over a duration of time for you to be able to function. So the Kenyatta doesn't have these implants, and you're told to buy. You go to the supplier, you are told is 200,000 shillings. A Kenyan who was riding a motorbike can't afford this. So they keep waiting in that ward, and as a doctor, you cannot chase them away, so you keep accommodating them, and they keep coming, you keep accommodating them. So number one is issues of policy and the structures in Kenyatta National Hospital. Number two, the funding. The government should be able to put enough resources for our public health system. We keep talking about the universal health coverage. And BICS Kenya signed a budget declaration which said that you must have a minimum of 15% of GDP going to healthcare so that you can be able to provide the basic minimums like implants in Kenyatta, employ more staff. The consultants, as Mheshimiwa said, are employees of the University of Nairobi, so they cannot be held accountable by Kenyatta National Hospital. The registrars who study there are still students in the University of Nairobi who work in Kenyatta without pay in the first place. All right. Number three, the capacity of the hospital when it was peeled. By now, the volumes of the patients have gone high.
Overwhelming.
So what we need to do, I think, we should have another center that will handle issues of maternal healthcare, build another big hospital for maternal healthcare, another big hospital for orthopedic and trauma cases, another big hospital for pediatric cases.
So basically decentralize.
Decentralize.
All those functions that are happening. I'll come to you for solutions because you've jumped the gun on that. Both of you gentlemen have really taken time to explain what is happening at Kenyatta National Hospital, and I'm just getting a report. Let me pause the discussion in studio. I briefly want to take you to the Nyeri courts, where a petition challenging the Nyeri law courts, where a petition challenging the election of Rigathi Gachagua, Member of Parliament for Madeira, has been thrown out by the judge there. The lawyer is now addressing members of the press. That's Honorable Gachagua's lawyer. Let's listen to what must be a celebration for him.
Thank you very much. I think today is a good day for the people of Madeira and for electoral justice. We are indeed very grateful to the High Court, the learned judge, for finding that the court has a responsibility to guard jealously the will of the people. And we want to tell all those people who go to court, no election will ever be won in court. If you want to be elected, you must convince voters to vote for you. In this matter, the judge has clearly come out to indicate that the petitioner was a surrogate for Phyllis Wambura Maranga. She came to court through the back door. I beat her with 25,000 votes, despite the fact that she put 1 billion shillings in Madeira. The people of Madeira ate the money, but chose the right leader. Once again, I want to ask the young people, because if you look at the petitioner, is a photographer, is a village photographer in a trading center called Yakaivei, who was being used by Miss Maranga. This is misuse of our young people, because she should have come to court herself. There is no need to misuse a young person like that one. And we must tell her now that this matter has been settled by court, to take her rightful place as a grandma, and she should be sitting with such young people, narrating them folk stories about the hyena and the hare, instead of misusing them in the corridors of justice. I want to say that now that this is over, we want to get back to work. It has distracted us for no reason. And you know that we have had 2 distractions, the people of Madeira. The first one is when Uhuru Kenyatta was taken to court and we repeated an election. The second one is when I've been taken to court. But now that this is over, we want now to focus on development. We want to focus on provision of water for irrigation for our people. We want to focus on tarmacking the major roads. We want to focus on giving electricity to all our households in Madeira. We want to focus on infrastructural development in our schools. We want to really settle down to work. And we hope now that this matter has come to rest, that lady can now leave the people of Madeira in peace to work, because we want to develop our constituency. So I want to say, I wouldn't say that we are very happy, our lawyer. We are actually irritated because we won a very clear election. We are just irritated that we have spent 6 months in courts, you know, for the court to just say what the people of Madeira said on the 8th of August. It is very irritating. And we want to ask people, once you are defeated, to accept defeat and try another time. So I really ask that lady to go and prepare herself, sell another piece of land, and prepare to face me in 2022, because this matter now is behind us. On another note, I want to thank our advocate, Mr. Wahome Gikonyo. The importance of this judgment and the role our lawyer has played, because he has defended this case very vigorously. I was under a lot of pressure from my friends and supporters to get lawyers from Nairobi, all those big names, because he thought that things can go wrong. We want to say that the winning of this case is a clear demonstration that we have enough legal talent within Nyeri County to deal with any case of any nature. And there is no need, for whatever reason, for us to go to look for lawyers from Nairobi. Let us build our own here, because they are competent, they are professional, and they can do a good job. So Wakili, on behalf of the people of Madeira, we want to thank you for the very, very able defense you have put up in this case. And you have been vindicated. You took a line of argument that the judge has resonated with. And we want to say this is a victory for the local professionals here in Nyeri County.
A very confident Rigathi Gachagua there, speaking after a high court threw out a petition against him and stated that he was duly elected as Madeira Member of Parliament, and the matter was before High Court Justice Judge Jairus Nga. And so the court has upheld the victory of Rigathi Gachagua after the August 8th poll, and he says he now wants to focus on matters development, paving roads, etc., even as he's given his first speech after that High Court ruling in the chambers just behind them. Well, let's focus back on the topic that we were discussing before we took you to that breaking news. This is Matters Kenyatta National Hospital. The 2 gentlemen in studio with me, that is Honorable Dr. James Nikal and Samuel Oroko, who's the chairperson of the KMPDU, had taken time to talk about some of the big issues affecting the hospital. And my question to them was long-term solutions for Kenyatta National Hospital. Clearly, it's not going to be a magical one-day funding proposal that's going to get Kenyatta out of where it is. What do you see, Daktari, as some of the things that need to be done long-term to ensure that by 2020, we are not talking about the same Kenyatta National Hospital that we have right now?
2020 is 2 years from now.
Is that far? Okay, 5 years, 2023.
That's not long enough.
Not long enough.
Because look at funding. let's start with let's look at the issue of funding. The Kenyatta's budget is probably about 13 billion, thereabouts.
Annually?
Annually. And out of that, approximately 9 billion will go on human resource.
9 billion?
Yes, will probably
That's
go
over
on,
70%.
Yes. So then you see how little is left for services. But even that does not come, all of that does not come from the government. Government will give about 7 billion, and all that really goes into human resource. So ideally, they should probably be talking about 13. And they raise the rest. Now, what then is the issue? The issue, you've seen in that, what I've said, there is no equipment. So let's take equipment, for example. They'll probably need 6-7 billion to get the equipment done at a go. But that probably is not possible. So my view, the strategy would be look at all the equipment that they need. Then they could stagger, how do we do a replacement on annual basis? So that you have a replacement plan. At the same time, you might also put in a repair plan, so that a maintenance plan, so that you don't wait that one day big money will come. It will never will. So there is need to actually gradually increase the budget to Kenyatta in a planned way, having looked at the needs in equipment that will be required every year. Now, if you then look at even the human resource, again, you need to stagger them like that. But in human resource, there's a much bigger issue that in my mind should be looked at. Kenyatta is a teaching and referral. Now let's just look at the teaching itself. As a teaching hospital, as my colleague has told you, half the senior staff are in the university. Only half are Kenyatta staff. So in terms of accountability, I'm talking of now the consultant level.
Yes.
In terms of accountability, 50% of your staff cannot be accountable to somebody else, even if you're in the same institution. Another half will belong to MTC, particularly in the nursing area, but that's not a very big thing. So my view for a long time, even when I was there, has been that actually Kenyatta should be made a teaching hospital and made a unit of the University of Nairobi. Hand it over to the University of Nairobi. You don't have to change the structures. The structures will probably remain as it is, so that the director of Kenyatta actually is a senior staff at the university, so that you have all this. Then that will solve the problem that all staff belong to one employer. The students that pay there, they actually pay to the same institution. Now the tuition that they're paying is going to the university, but what they're using, even the undergraduates, what they're using is from Kenyatta, and I don't think that is taken into consideration, so that you have one unitary thing, and then the real need for the actual requirement will be seen.
Okay. I want to see if Samuel agrees with you. Do you think that's a viable solution?
I agree to some extent, but as I said, number one, Kenyatta is unnecessarily congested.
Okay. I think that's clear to
that's clear.
Yes.
So the first thing is to ensure that the other facilities lower than Kenyatta are fully functional. Like you go to Mama Lucy, there is a whole stall block which was meant to house the ICU unit. It's not functional, it's not even complete. So you get everybody in Nairobi who has trauma and needs ICU, they have to come to Kenyatta National Hospital. You go to Mbagathi, there is no functional ICU. And many other departments, including the trauma department, including theater, is not functional at Mbagathi Hospital. So if we make, number one, there were 5 facilities functional, especially Mama Lucy, Mbagathi, Pumwani, and other surrounding facilities. Number two, the counties. They equally need to equip their county hospitals to capacity and employ specialists who are enough to handle some of the cases which are unnecessarily referred to Kenyatta National Hospital. That is the first level of decongestion in Kenyatta National Hospital. Number two, if you look at the number of theaters in Kenyatta, there are 12 since it was built. And these theaters sometimes are not enough. You get a list of 30 patients waiting to go to theater. The surgeons are available, ready to operate, but you get all theaters are occupied and there are patients waiting. So in that case, number two is to increase the number of theaters from 12 maybe to 24 in the minimum, so that those patients who wait for 3 days really to go to the theater, you get a patient is in the ward and has abdominal issues, they wait for 3 days. By the time you go to the theater, it is complicated. They have abscess, and now you have to cut the intestines and the repair, and patients go home with an hanging bag where the feces has to go out all the time because of delays within the hospital itself. Why? Because of insufficient infrastructure which is required. Number three, point of decongestion in the long term. Let's be realistic. Kenya will continue to grow. And we have been told by 2022 will be about 50 million Kenyans. All right? Kenyatta, as it is now, will not be able to handle even the genuine referrals alone. So it's to decentralize some units. And I'm happy the country now we are talking about universal health coverage, free maternity. The first thing this country should do in the long term is to put up a center of excellence for maternal and child health care. Identify land. I know this country has a lot of land. Identify land and put up a center where all matters they go when they want to deliver. And you remove that unit from Kenyatta. And now when you do that, create another one for trauma. Even becomes a center of excellence for trauma and orthopedic care. And when now the universities want to train, they take their registrars
to that
those centers for training. That way, be able to decongest Kenyatta. But in the short term, Kenyatta should be able to repair and replace all the old radiology machines.
Okay, Dr. Nikal agrees with you.
CT scans.
Yes.
Number two, employ staff of their own. I agree with him. And number three, the University of Nairobi and Kenyatta should be able to terminate the MOU which they have been having because it's not working.
It's not working.
The University of Nairobi should be able to build its own teaching hospital.
I want us to talk
and
about
leave
teaching.
alone Kenyatta National Hospital.
A comment from you, just 1 minute. KMP, do you have issued now it's now a 13-day strike notice. You issued it yesterday. You say that doctors lecturing at public universities will down their tools because of unpaid risk and emergency call allowances. Why do you think the government is not honoring that agreement that was signed in March last year? And you issued a press conference yesterday on the same note.
I think it's bad behavior by government. But
because I want Dr. Nikal to respond.
You know, when we signed the return to work formula on 13th of March 2017, we agreed and we signed that all doctors working in public sector will benefit from the allowances which we negotiated. And it was put in the budget. Now, the government is taking people in circus. And why they are not honoring this, it is this tradition where government of Kenya has been signing documents which clearly they don't want to honor. Even I'll tell you right now, doctors in the counties have not fully been paid what was agreed in the CBA. The basic salary was adjusted, promotions were to be done by December, and the job redesignations were to be done by December. It has not been done, even at the county level, even alone universities. So yes, that, in the next 13 days,
yes,
all the doctors who work in medical schools were equally lecturers. We down their tools, and we need this allowance to be paid.
Dr. I want to find out, because I believe Parliament's Health Committee is supposed to keep the health sector within government accountable. You're supposed to keep the health ministry accountable and just ensure that all is working well in that particular sector. Are you aware of some of the claims that he's making or allegations that he's making And
I'm
what
aware,
can be
I'm
done?
actually even more aware than just being a member of the health committee, because I've been in this sector for a long time.
Okay.
And I want to agree with him at the start of that. There is a lack of sincerity when there are negotiations. And I think when the government is under pressure, they actually agree to things they can't do. And that is very unfortunate.
You believe that is the situation? They agreed to
because these CBAs that have caused problems, the first, when they went on strike, he was he's in the union, he knows, was a CBA that was signed in 2013. That is what brought the problem in the first place. It was the same with the university. Again, the CBA that was signed in 2013. It was the same with the nurses. Again, the CBA that was signed in 2013. It was never adhered to. In some cases, they even refused to register the CBA. Now, we had the big strike. And now what then has happened is now they signed another CBS in 2017. But look at it also, the relationship that and election years. Because when the election years are coming, there's need to solve problems, and so you say things you can't do. Again in 2017, just before the elections, these CBS were signed. Now we are here with them, the CBS have not been adhered to. So, and the one of the doctors and the university lecturers issuing a notice at the same time illustrates what I just said,
okay.
The dual role of Kenyatta. But what then would be the link between the university lecturers and Kenyatta? Simply because the senior people, the senior consultants in Kenyatta are lecturers. Half, 80% of the workforce are students. So then you have that. So that when there is a strike of lecturers, it will definitely affect Kenyatta. So that is another issue. But I wanted to go back. Let me just go, if you can allow.
Briefly.
On the issue of decentralization and the issue of Kenyatta doing its work of being a referral and teaching, I think that cannot be overemphasized. We demonstrated in 2004, 2005, particularly with maternity in Kenyatta, that there was a huge congestion. I was in the ministry then.
Yes.
We were with the Minister Ngilu now, who is in Kitui. And the only way we could decongest the maternity was to actually open up 11 delivery units that were actually in Nairobi and were not working. And that is what eventually brought in Mama Lucy. And that's what brought in Magathi being changed from an infectious diseases hospital to now as a county hospital. So that, if these units are open, and the county...
They are still there.
They are still there, and I don't know whether they are working.
Okay.
So the county of Nairobi, the county of Kiambu, the county of Machakos, I think to some extent Makueni, but Makueni's health system is working pretty well.
From what we are reports we are receiving.
Yes, I've been there. It's working pretty well. Even to some extent, I think Kajiado will, Naivasha may. Now, but these countries that are close, really, they have to make their services work so that the ambulances they buy that are received very well politically do not just serve the function of congesting Kenyatta, but they should have those patients there. And I think there should be some discussion between Kenyatta and the 5 countries. We should analyze the patients we see in Kenyatta, where do they come from? Do they need to come to Kenyatta? And if they don't need to, where do they need to be seen? If it's Nairobi County, we should have a discussion with Nairobi County. Why are your people coming here?
Going
if it is
direct
Kiambu,
to
it is
Kenyatta.
that. So I think that is, I think I wanted to say that in terms of decongestion. Any attempt to decongest Kenyatta by just focusing on Kenyatta, even if we put more money, will not work until we do the decentralization.
We give alternatives.
We'll give
those
alternatives.
who would have gone to
Yeah.
Kenyatta. I can give you, you had had you finished?
Yeah, I think that is my, yeah.
Okay, let me give you 1 minute just to respond to some of the new thoughts that he's added, including the time he spent in the ministry and what they tried to enact.
Yeah, that one I agree completely, that these facilities are there. The reality is they are there. Another reality is, sad reality is that they're not functional to capacity. And as I've said, and we have said all the time, what we need is proper leadership and governance in the health sector, both at the national level and at the county level. Because for a functional health system, all the pillars of our health system must be functional. And for this country, what has been the biggest impediment is leadership and governance. Number two, healthcare financing. This country depends more on donors for healthcare financing. So we need to look at our own local resources and see how we can redistribute the resources to cater for our health sector. Another key pillar is human resource. And this is another pillar that has been ignored for long, human resource for health. And as a body, as a union, now we are proposing that for us to be able to avoid even this constant disharmony strikes in the counties, it's high time we form a central body to manage human resources for health. And that one we are proposing something similar to Health Services Commission, which can be able to centralize.
Service Commission.
Exactly. Counties can build hospitals, can buy ambulances, can buy CT scans, but issues of pay, recruitment, deployment should be centralized and these people be deployed. Because this county level employment has brought in tribalism, nepotism. Even that's why right now, many doctors are out there who have not been employed, about 1,400 doctors. And this year there are more who are qualifying, coming out. At the end of the year, we may have 3,000 doctors out there who are not employed. The reason being, counties don't want to spend money in recruiting competent and qualified staff. They want to employ middle-level staff and spend less money
rate, that's right,
at the disadvantage of the patients, because when patients will be managed, in the society which will suffer when they complicate, then they come to Kenyatta. And we have seen a lot of those cases in Kenyatta National Hospital, where many cases have complicated at the county level. They come with open abdomen to Kenyatta because of the quacks at the county level have been employed or are being paid cheaply.
Okay.
They mismanage patients. They come to Kenyatta every day. We do see them.
Okay, okay.
Yes.
Very worrying, but very interesting thoughts coming out of this particular discussion. One that we will need to keep having, and I hope that both my guests have managed to share between each other what needs to be done. They both play a very crucial role in the health sector. Thank you so much, Dr. James Dikal, who's a member of Parliament, SEME, but also...
But I know it sounds like you're closing, but I want to say one thing.
You want to say one thing?
Yes.
Briefly.
Now, all this has been complicated because we have not handled devolution properly. He just told you about over 1,000 doctors are out there not employed. Now, the structures, the health systems he's talking about, they are structures that were centralized: human resource, equipment supply, drug supply, the training of people. Now, with devolution, we have not had time to actually sit down and work out very carefully. If you talk about doctors only, now you're talking about these registers we are talking about in Kenyatta. They are working in Kenyatta. Now, who is paying them? Now they're in the counties. Now, when they come to the counties, if they're being paid at the county, who is working in their place? That has not been worked out. Talk of interns. The interns are now, a batch is just about to qualify. Now they're being paid by the national government because that's a training function. The day they finish, is somebody prepared to know which counties are they going to work in?
Yes.
So I think there is also a structural problem that we need to look at. Now, the other thing that I think we should do, we can't leave here without saying, is the implementation.
Please, yes.
The implementation of the Health Act, because there has been an effort through all stakeholders, including them, to get that, solve some of the problems.
Thank you. Thank you, Dr. James Dikal. And thank you also to Samuel Oroko, who's the chairperson of the Kenya Medical Practitioners, Pharmacists and Dentists Union. Well, let's tell you a little bit about what's happening in